Now we come to the last presentation of the session, Comparative Analysis of Visual Outcome of Indian Enhanced Monofocals and EDOF IOLs by Dr. Kuldeep.
Respected chairpersons, seniors and my dear friends, I am standing in front of you to discuss the dilemmas that we face, especially with respect to the Indian IOLs, because very less literature is available as far as their performance and predictability goes. We all know that multifocal IOLs have their own disadvantages, and that's why the EDOF technology has come into existence. And there are various ways by which EDOF mechanism is exerted by IOLs to achieve the extended depth of focus. We are comparing two types of IOLs which have extended depth of focus by an apostrophe suprafocal in focus, where the company claims that this can produce a central zone for near, larger mid-peripheral zone for intermediate, and outer zone for distance, and that is mainly by the peripheral asphericity to increase the effectiveness of near as a support for the optical power of the lens. And the second one is a Care Group's magnificent ultra high depth focus lens, which they claim that it enhances contrast sensitivity with true multifocality effect, thus reduces grays and halos, and that they claim it to be their patented technology. So both of them come in the similar price range, and we need to discuss the evidence which lens gives better distance, intermediate and near vision. So that was the purpose of this study. It was a single center study where we included patients with less than 1 diopter astigmatism. A single eye was included, and a standard phacoemulsification where the incision was done on a steep axis was performed by an experienced surgeon. In all patients, optical biometry was performed, and we looked at uncorrected distance, uncorrected intermediate and uncorrected near. You can see in this chart that both the groups were comparable in terms of demographic details as well as ocular details as well as grades of cataract. When we compare the distance visual acuity on day 1, day 7 and day 30, there was no statistical significant difference, but the important point to note is that almost 70% of the patients did not reach better than 6/12 vision acuity. So 30% of the vision less than 6/12, so that extended depth of focus, wherein that wide focus is achieved, not a central pinpoint focus, can reduce a distance vision a bit. As far as intermediate vision goes, in the day 1 and day 7, although the extended monovision or Care Group lens gave a better result, but at day 30, you can see that the better vision was good and borderline near vision and intermediate vision was there in Upper Swami Group's extended depth of focus, because in 3 patients of Care Group's magnificent EDOF, they gave a poor vision. So it was not giving a consistent result. The same trend was observed for near vision, wherein although the good vision was achieved in EMV or extended monovision group, but overall, if you look, the predictability of good and borderline vision was better with the EDOF technology as compared to the extended depth of focus technology by Care Group. So we need to really look while convincing the patient for these premium IOLs and discuss their needs, look at their distance vision needs, and then counsel them for the individual choice of IOLs. So these lenses are available at an affordable cost, but when we are promising a result, we should be sure of the results. That's my point. Thank you very much.
Don't you think you should have done the study with both the eyes? I mean, like just one eye you done the study? So these technologies
we
are always...
We are doing it, ma'am, because right now the other eye is not operated in many patients before the abstract was submitted. So that's why I could analyze the only result of the single eye.
So is there any Indian make EDOF other than the Care Group?
Acryl is there.
That
is actually that Care Group doesn't have a EDOF. That is a mainly
Learning conioscopy.
They don't have a typical EDOF technology. They have a different technology. So if you look at how the EDOF is achieved, it could be aspheric aberrations, or it could be a contrast sensitivity, or it could be a spherical aberrations and pinhole effect. They have a different technology, so they don't call it as a EDOF lens. It is similar to IHANS technology, you can say.
So your results confined to between the Care Group and this.
Yes.
But IHANS is not EDOF.
That's what I'm saying, that magnificent is also not EDOF. But they both claim that they give a better intermediate, so we wanted to compare between that.
You
said that for the intermediate distance, after a month's time, both are same, almost same.
Yeah,
So, what do you think is the cause? Is it the surgical procedure that is the cause, or incision site that is the cause, or is it just because of the lens? And
The-
it's if you-
the when to achieve that extended depth of focus, we the point focus is not there, and that's why there is a wide landing zone, and that can reduce distance vision to give a better intermediate and near vision. So that is the mechanism by which EDOF works. So in EDOF, many times if we look at single eye, the distance vision is not good.
Basically binocular.
Yeah, binocular vision we have to.
Sure, good, good.